And hello, welcome to ICRC-TV COVID-19 HR and Business Updates. My name is Pandy Pridemore, founder and principal consultant for the Human Resource USA here in Cincinnati and the Ohio market. I want to thank you guys for the wonderful, wonderful feedback we have been getting on this show. I've got some real excitement for you today. Got one of our favorites, Scott Warwick, back from Scott Warwick Employment Services to talk about all the horrendous changes that have occurred here in the past 2 weeks. We haven't done a house cleaning of all the different movement within COVID and HR, but Scott's going to help me walk through some of those with you because we're getting some confusion out there. People are not keeping up with some of the updates, and I really want to make sure that you understand dates are changing, guidance is changing, some of the regulations are changing. So we're going to walk through those for you and help you understand how to shift your calendars a little bit. And then later in the end of the show, I've got a big surprise in that we will be introducing brand new software from a company right here in Kentucky called Red Hot Technologies.
Very weird.
They have come up with symptoms screening application. It's the coolest stuff. When Matt Strippelhoff, the president, and I got on the phone, we started talking about some things about it. I thought, oh my gosh, this is definitely something our viewers want to hear about. You need to know what options you've got now to address some of these regulations and rules and guidance with CDC and OSHA. And Matt has come up with a phenomenal, right here in our own backyard in Northern Kentucky. A wonderful, wonderful application. So let's just get started. Oh, and by the way, hello to our viewers in Arizona and Texas. We are very glad you're with us today. Remember, anyone can send in questions or comments. All of our presenters are more than willing to answer questions for you. So Scott,
Awesome.
Join me here. Let's get right into it.
You know what you want to do after you graduate?
Okay. Can you hear me all right?
I can hear you.
Okay. Maybe a good place to start is with all of the questions I've been getting lately. And hello, Arizona. I got one of my clients out in Phoenix. I don't know if they're on here today, but it's very difficult
kind of TV?
to operate
Like live TV?
So
News?
we're going to operate this as a federal type of thing, but individual states, you gotta be looking to see what's happening in your state. But overwhelmingly, the questions that I'm getting more and more and more are, and it kind of does relate to the OSHA types of stuff. Oh my gosh, what happens if somebody gets sick and they get COVID at my place? Or, how do I avoid liability? And let's just kind of hit the high points real quick. And this is just to calm everybody down, all right? So, and this is what I've been giving a lot of tea and sympathy to my clients lately. You're not in trouble because something happened.
For sure.
Okay, so let's just say, and I like to use the analogy to negligent hiring, negligent retention. Let's say you have an employee that gets really mad.
So how much do you know about what we do is kind of a whole
a customer.
Obviously, I don't expect you to know that much. This isn't a test
You're
question.
not
A lot of people act like I expect them to know a whole bunch.
Responsible or liable if you have an employee that goes up and smacks a customer because you couldn't foresee that. And you took reasonable precautions. You did background checks. There's nothing in their background. But let's say that you are an irresponsible employer. And let's say that this guy works for you and he's got 2 or 3 domestic violence assaults or something like this, and you never did anything. Yeah. Well, yeah, it's kind of foreseeable that
we do a kind of a mix of just about everything. We don't do a whole bunch of college sports,
place safe,
but we definitely
Pandy, I'm
concerts, summer concerts, things like that for sure.
On my website,
and then a lot of sports, and then a big part of what we do outside of the internships is government meetings.
Is that 30-minute video,
which is not necessarily the most exciting thing in the entire world, but it's
on how
definitely an important part of what we do as far as the access is concerned.
All of those types of things.
So yeah, normally our internships are based mostly in
how to do these things. So all my clients, and I'm talking about
like our TV trucks. We've got 2 HDTV trucks. With graphics, cameras.
You got to make sure you're following those guys.
Most of what the internships are based on is live TV, live sports production.
And as long as you are
given the current situation, and obviously during summer there's already less
your legal
sports going on.
Actually,
we usually do have like all-star games and things like that, but at this point, I believe those have all been pretty much canceled.
Was doing all this stuff that we're talking about.
So it's kind of approaching it on a different level.
Someone called the Ohio Department
than
of Health.
what we normally do.
Well, the Ohio Department of Health showed up just like they would in any state.
To start off with, what we probably be doing is something
to see what my
where there are guided,
everything you're doing is perfect,
but a free range, if you will,
perfect
editing projects and things like that.
You know, that's your liability.
Do you have access to like an editing software or anything at home?
Really start thinking, what do I have to do to keep my workplace clean? And if you're wondering what that is, I've posted free stuff. There's a lot of good stuff out there from the CDC.
What kind of experience do you have with the Adobe Suite?
But the one thing, you have to train your people. OSHA's requiring that. And really, the bottom line is nobody should be getting sick. If you follow those guys, they should be safer coming to work than going to the grocery store.
Well, and I think that's the biggest confusion right now. And I just want to thank you for going through that, because each state has a website and it has some of them are calling them toolkits, they're all calling them guidance, but some are requiring reporting, they're requiring masks, they're requiring very specific things. Others are just recommending it. The word, you have to really look at those operative terms: must, required, should. Those are very, very important. And I'm reminding my clients that have multiple locations, just because you're not there, but you have a office or an established warehouse and you've got maybe 5 or 6 people, you have to abide by that state's guidelines, and that you're putting extra effort there as well. So I think that's a wonderful, I think that fits the show very, very well, Scott, that we've got to remind people to be very cognizant of where they are in their area.
Right, absolutely, because there could be some, and I'm in several states, like here in Ohio, if you go to work, it's mandatory to wear your mask unless you have a little doctor's note. Okay, well, that's a loophole big enough as the Holland Tunnel. So we just deal with that, and you work through it. What is the safe thing to do? And here's the thing that really I try to remind my clients. There's 2 major ways that you get COVID that we know right now. So 2 major ways. One is somebody comes up and breathes on you. Okay, it's that hot breath. It's not necessarily just airborne, like floats in the air. It's in the moisture in your breath. So, you know, don't lick your friends, don't breathe on them, don't get right in their face, you know, social distancing. But the other thing is, you touch something, and this is debatable because just yesterday there was a report that came out as to whether or not this even lives on surfaces. Well, for right now, assume that it does. The number one reason people get this is they touch something and then they touch their face. And the average person touches their face 20 times an hour. So, and like, how do you put on a mask? And so I go to the grocery store and I just watch. I haven't seen anybody put on a mask or take it off correctly yet, because they cover their hands in cooties. All right. They then touch the mask. Why don't you just lick the doorknob? Okay. Because you're putting these micro particles up against the mouth. The mask protects moisture. When you put your hand that could be full of germs against your face or your mouth, you've just defeated the purpose. So I keep my hand sanitizer with me all the time. I never touch my face without desanitizing my hands. And those are just a couple of rules that can help this hypersensitivity of your people that are afraid to even breathe air.
I got a call this morning, and it was a manufacturing firm. Of course, they're wearing the masks when they're not able to social distance, but because of the substance and the work that they do, the dust is horrendous. And with the extreme heat, there's a lot of sweating, so the dust is adhering to their faces, it's adhering to the masks, and that becomes a health issue. But yet the office group wanted to remove masks and put shields, face shields on. And I said, oh my gosh, don't they understand that it comes? So anyways, there's a lot of questions out there, and you really need to review your state guidance. Find out, again, what those operative terms are, and then understand that OSHA's the bottom line. You have to provide a safe and secure workplace.
And that's for everybody, wherever you are.
Exactly.
Yes, follow those guidelines. And I don't compliment the federal government often, and I'm not going to compliment OSHA later, but OSHA's guidelines as to what you got to train your people in, that they got right from the CDC, are good. They are really good, practical. Absolutely. And the bottom line is, you don't want to get sick. Forget the law. You don't want to get sick.
No, let's go back. Let's talk about being sick, because the CDC has come out with a little bit of a modification there on their guidance on, how to put who should be in quarantine and who shouldn't. But now we've got the confusion that individuals are not required to provide a negative test. So let's say someone tests positive, they go through the quarantine process and the healing process, but to return to work, employers are now saying, well, I want a negative test. And quite frankly, as I was reviewing some of the state law this afternoon, state law, well, let's say Illinois, is still saying, hey, 2 negatives within a 24-hour period.
Right.
You have to know that if you have multiple locations, and yet Ohio is not requiring that. I don't think Kentucky's requiring it either. So there's just a lot of confusion on there because the changes are still occurring.
Yeah.
I would say if you're not checking it on a weekly basis, then you need to be checking with your consultant or your labor law attorney and finding out what they can update you with. Some of it, you have to have that document. Don't assume that what you learned 4 weeks ago, or what even Scott and I told you 6 weeks ago on one of the first shows, do not follow that. That's why we're here every week.
Right.
Update you and keep you current.
Right, and this really is a daily pulse. And like I said, and now there's some reports coming out that this COVID virus does not live on surfaces very long. I pray to God that's true. I hope that's true. But the bottom line is, you start looking at what should I do, what shouldn't I do. Number one, if you are in Illinois, and I got clients in Schaumburg and Chicago, so honestly, they've made it easy for you. You got to have these tests before you come back. Okay, but if you're in Ohio where it's not required, the big issue, you start thinking, well, it's OSHA going to tell me. No, I just finished, and I'll tell you, I've produced more videos in the last 90 days than I've done in 10 years. Okay, because and here's one of the things that I want to make sure people are stressing. We're talking about the CARES Act, Families First. We're talking about the OSHA regulations and things like this. Don't forget, the ADA is still there. Okay, and I'll tell you, I've seen more ADA violations in the last month than I can remember. Oh, and Fair Labor Standards Act. We are slaughtering wage and hour law. So you see, the assumption was, well, people already know the ADA. Well, I'll tell you, you better bone up, because the EEOC oversees the ADA, and the EEOC has told you very specifically, you have every right in the world to do your testing. You have every right in the world to tell people who's got COVID. So you don't go up and say who's got MS. But if it's got COVID, and the difference, oh, Bill's got COVID. Yeah, so he tested positive, he's home. That's okay. You see, the EEOC is actually taking a very proactive stance, because you don't catch some of these other diseases from people, but you do catch COVID. So, I'll tell you right now, I've got clients, and I'm looking what state they're in. I'm looking at their situation. And if they have somebody that has tested positive for COVID, in the vast, vast majority of those situations, I want a negative test before you come back. And somebody will say, well, OSHA says I don't have to. Well, we're not playing the OSHA game right now. We're playing the ADA game, and I don't want you to kill your coworkers. Because some people will try to come back even though they're sick because of the money. And here's the other part. Okay, they've been tested positive for COVID. Don't pay them out of the Families First. Put them on the CARES Act. Doesn't cost you anything, and they're going to get their unemployment plus $600 a week. You got to be smart. You got to know how these laws work.
Well, and we want to remind everybody that these programs are in effect till December 31st of this year.
That's correct.
Even though the PPP money has an expiration date.
Right.
And let's talk about the PPP money, because some updates just came up as of March 22nd, and Don did a wonderful job. I think we just got him on the show 2 days before these came out.
Yeah.
So a lot of questions have come up about what is forgivable and what's not forgivable on the PPP loan. And there are some changes in regards to how to consider the time period for that. But in terms of payroll, I've had questions come up and say, well, can I use an attendance bonus as a part of my PPP loan? Can I just give everybody a $2, it's just a reward and a thank you for sticking with me as an essential worker? Can I put that against the PPP loan? And as of the 22nd, they're going to allow you to do that.
Yeah.
So if you have if your PPP money is still in effect and you're still worried about, meeting that forgiveness, I cannot encourage you enough to get back with your CPA, get back with your SBA banker, and review what you want to do with that money, because these guidelines have changed here in the last week again. And we want to make sure that you're able to take advantage of all those changes.
Yeah.
I mean, when does the government ever work in our favor? And now they're just throwing us bones.
To it, yeah. But honestly, it's already passed the House that they are going to extend the timeline. And this is what Dawn did such a great job a couple of weeks ago, talking about you got a 10-week loan for payroll types of things, and you've got 8 weeks to pay it back. So you got a real compression problem. And now I can't imagine the Senate not passing it to allow you more time, because everybody's thinking, well, hey, by August, we're going to be clear and whatever. So, but no, I think that is the biggest thing. And yeah, stay tuned as to what's happening, because if you do have the PPP money, then I fully expect that the Senate is going to pass what the House already passed. And the House has said, you get more time. So that compression problem goes away. Yeah. And it kind of makes sense. It's like, oh, you can open up. That doesn't mean people are going to come and start eating. Okay, they're not going to start going back to the zoo, or they're going to start doing, it's just amazing that you can open a business, but that doesn't necessarily mean people are going to come, and you're going to have to ease people back in. So yeah, I think Congress, honestly, compliments to Congress on the Families First Act, the CARES Act, extending the PPP, and the unemployment portion of the CARES Act. I think that they've done a bang up job, and they can all fight it out like whatever. And stay tuned, because it's going to be very interesting to see what happens with the CARES Act unemployment, because there are rumblings of extending that past July 25th. But let's just see. Don't plan on that. Yeah. But piece by piece by piece. The biggest thing is keep your emotional intelligence. Don't panic.
Exactly. Yeah, we have talked about this a million times. Hysteria has got to be removed from any decisions or activities of COVID. We just have to keep our heads about us, and keep our professionals around us to help us work through this. Which leads me to the next one. Some changes have occurred involving Cafeteria 125 plans. So if any of you have FSA accounts, if you are any kind of ERISA accounts involving a Cafeteria 125, please get with your brokers.
Yes.
Some extensions have occurred on those deadlines. There's some lenience there that you really want to make sure is being conveyed to your employees, because again, that's money that normally is, you can roll over 500 at the end of the year. There's a time period of 2.5 months you can use it. Now some of this is all kind of relaxing again.
Yes.
But it does take plan amendments. So it isn't something that you can just read up on in the newspaper or listen to on the news and just do. You need to get with your broker.
Yeah.
And get those legal documents, because again, who's involved with a Cafeteria 125 plan, but the most fierce of all, the IRS.
Sure.
So I think it's great changes. I liked the changes that they were trying to do, but again, it's going to cost some administrative costs. There's some, it's going to cost a little bit for you to modify and amend that plan.
But it's a great benefit. It's a great benefit. It's a great benefit, and it's worth a phone call. And honest to God, I've set up these plans when I was in-house, and I always surrounded myself with competent people. And if you don't have those, like good accountants, good TPAs, everything, here's the thing. Call the guy. Just call the guy, call the gal, call the person, and they will always take care of it for me. And that's what you've got to do. But you got to make the phone call, and you got to make sure that you're getting, and here we go. We're back to trust. Is it safe to work at your company? Absolutely. It's clean. Here's this change in benefit laws. I'm going to make sure that you've got these benefits. You're sick. You got some symptoms of COVID. Okay, so guess what? I'm going to put you on the unemployment. I got an employer, 18,000 employees, one of my clients I'm ready to strangle, because their HR department has turned around to the employees and said, oh, unemployment, we don't give advice on state government. You're going to have to figure that out on your own. And I'm like, oh, somebody wants a union. Okay, somebody wants a kick me sign on the back of their head. You've got to be kidding me. I would set up tables. I would open it up 6 feet apart. I would go online.
It's public information.
Oh, yeah.
You want them back.
But employees don't know how to do this stuff. It's like, if I've got an employee that's an expert on getting unemployment, that's probably not an employee that I want. Okay, so you've got to help these people. You've got to make sure, and that's why I'm putting out so much stuff for free, because actually I'm getting a lot of hits on my website in the evenings from individuals.
Yeah. Oh, I'll bet.
And I love that. You get your unemployment, get the benefits, get yourself taken care of. And your employer, all you employers out there listening to me, you can build trust here where you are really helping these people. And honestly, that's your job. That's what you should be doing.
Well, you know what, Scott, I do tell my clients, don't tell them the exact amount that they're going to get. Let the state calculate that.
Yeah, I agree.
Some of my guys want to go, oh, but I got to make sure that they make $500. Like, oh my gosh, you can't do that. You just.
It is what it is.
It is. Yeah. That's right.
It is.
Right.
What it is.
It's not a formula.
Yeah, but get them into that portal, because it's been kind of hellacious in the last 60 days or so to help people get benefits. And and so my wife is qualifying for benefits now with her job. And I will tell you, I do this stuff. Oh my God, I'm ready to hang myself. This is horrible to try to go through. And I do this, and it's very difficult. So picture the poor employee out there who's never done this in 30 years. And now they're trying to get in there through these portals that are designed by Rube Goldberg.
Well,
you got to help them.
Here's another, just a hint. I've had 2 individuals call me and say, actually 2 companies, saying that the employee lived in a different state than the corporate office where payroll was processed, and both states were denying them because she instantly, or the individual applied in the state of her residence. They kicked her and said, no, you have to collect unemployment in the state of your company. And she went here and they said, oh, no, it's a state. So your HR person should be doing the work first to figure out where that unemployment's been paid.
Yeah.
Federal plan, we get it, it's a federal plan, but right now there's a lot of confusion. So please don't make any promises. And a lot of the documentation is right on the website for that state unemployment office. So
you're going to play hacky sack. The states are going to play hacky sack with the employee. Yeah. And there, believe me, there are rules that clear. And as soon as you mention this, it's like, well, this is pretty clear whose state is responsible. Okay. So, but honestly, you've got some person that is not an attorney, that is not a real specialist. And I'll tell you, I got a state that I got clients in about 20 years ago. They did an audit and they found out that about 15 to 20% of all the unemployment folks on first round intake were illiterate.
I'm not even going to comment on that.
Yeah, that's so. I'm sure that's not the case now. I'm sure you've got, competent people, but you do run across folks who just plain old don't know what in the heck they're doing. And there's still states out there where if you call up to try to get help, they will put you through the prompts. And once you go through the prompts, they will hang up on you.
So let's move on to some better news.
Only the state.
Some of the carriers are making changes to the provisions they've been providing for employers. And if you'll remember, Jamie Charlton was on this show here a couple of weeks ago and was sharing all the different advantages that have been put into place for employers who weren't able to pay their premiums. Well, again, one of the biggest messages out of that particular presentation was that if employers are not making their premiums payments, the claims are not being paid for those employees. So get with your broker. If you're an Aetna plan holder, check with some of the other carriers, because I haven't seen any correspondence from them, but it's bound to happen. They're going to have to extend some of these deadlines. They're going to have to add some provisions. But again, whatever you decide to do as an employer, if you take advantage of some of these programs, it's going to affect your employees. So I cannot stress enough that you open up that communication and share with them, look, we're not going to pay the premium for a while. We're allowed to do this, but your claims might be affected, and here's the correspondence or communication that might be coming back to you.
Absolutely.
Work it out with your broker.
And what a perfect use for PPP money if they get it. And there's still money out there. There's still money today as we speak. There's still money.
Yes.
Yeah.
Yes. So again, we've already told you, you need to be with your banker and your SBA loan officer, your CPA.
Yes.
Now we're putting you with your broker with the FSA accounts and your Cafeteria 125 plans. And now we're telling you to get with your insurance brokers. That's 5 people we've already recommended to you today.
Oh, and you'll look like gold. You'll look, I mean, really, you're there for your employee. They don't know this stuff. I mean, we're doing this to try to help employers so that they know this stuff. Employees don't know this stuff.
They're not supposed to.
No, they're supposed to do your work.
So another big update is the OSHA decision on reporting COVID-19. Now, you know, it wasn't a big change, but there's been a lot of talk about, do I report if someone shows that they're positive in the workplace? Is that something that goes on the 300 report? And you know, it's go ahead and take that one, Scott. I know you just love the conversation.
And what with the right hand giveth, the left hand taketh away. Okay. Let me just start off by saying this is ridiculous. Okay. My compliments to OSHA on laying out what you need, very practical advice in keeping a safe work environment. I love that they require training, because you would think people know how to blow their nose and that they know how to do these things. No. Okay. That's why we have a pandemic. However, this is just dated May 29th. So this is fresh hot off the press. What do you report under COVID? Well, first of all, there are some requirements here. Number one is the case is confirmed as COVID, as by the CDC. So somebody in your organization tests positive for COVID. That certainly makes sense. Makes sense. Number two, the case is work related. Are you kidding me? Right? Are you kidding me? Okay. And we throw these terms around like as if, well, all you have to do is trace the employee's movements. Really? Do you know how many hundreds of millions of dollars have been spent in this country on tracing? Okay. And if you do the history of tracing, it actually goes back to cholera. It is how we first diagnosed cholera in England. And now we still do this today. It's still a very, very bona fide way of doing things. But you know how anal retentive you have to be to trace all this? An employer, you are not set up. Now, let me give you an example of where maybe somebody could say that I got COVID from you. All right, so let's say that you have 50 employees and you are not following any of the CDC guidelines. You're not following any of the OSHA guidelines, and you are like Smithfield in South Dakota, you were giving $500 bonuses to everybody who had perfect attendance, which that is stupid, okay? If you're sick, and one of the things in OSHA's training, they say, look, if you're sick, stay home. Don't do me any favors. So this John Wayne pull them up by the boots type of thing is going to get people killed. All right. So, and then let's say that you don't have any hand sanitizer. Let's say you start getting a few cases of COVID all at your workplace. Maybe then you can show causation. And let's go back to good old fashioned workers' comp, good old fashioned OSHA. Was that accident or illness or injury caused at your workplace? So let's take it in the case of asbestos. People don't necessarily go around and have asbestos in their house. And if they worked with asbestos for years, there's a very good chance you got it from your employer. This is a virus. And understand, we're making this up as we go along. And so think of the places you go in the midst of a day that you might go to the gas station. And I'll tell you right now, if you go to the gas station and you are not dousing that with alcohol or vodka, you're crazy. I mean, that is a germ fest right there. And so honestly, the thing is, number two, the second thing there, I don't know how in God's name, unless you've got a blatant, clear cut slam dunk, in which, and I tell you, if you got a clear-cut slam dunk that somebody got COVID from you, if you're in a state like Ohio, oh, they'd have shut you down by now. They'd have shut you down. So this whole thing is politics for politics' sake. I can, and if you definitively say that this came from your workplace, you don't have to report it. So I would take this, read it over, And then I'd play basketball with it to try to see how many times I could get it in the trash can.
Yeah, I love, as much as I love how you describe things.
Oh, it ticks me off. Of all the things we got to worry about now, keep yourself clean. And remember my story about my client where the Ohio Department of Health literally showed up and they said, this is perfect. You got no trouble.
And it's important that employers are recording what they're doing. So if you do have somebody in the workplace cleaning, you record that. You record that they've been trained on COVID practices and COVID cleanliness. And you don't want grandma coming in and cleaning in the evening without training her. She's got to know, get the cracks and the crevices, get the doorknobs. You know, I told one client, I said, look, I want you to even take pictures of the tape around the time clock. I want you to actually have evidence, because again, this could be recalled 18 months from now, and we don't want to have to be scrambling for anything. So keep the records. Documentation is absolutely essential in anything you do with COVID.
And that's an OSHA guideline. And I'll tell you, take what OSHA just put out on this and just, what the heck? But look at what they put out a month ago. And honestly, I'm trying to make this as easy as possible. Just download the stuff from my website and then run away. Because I stole it. I plagiarized everything from OSHA, because exactly like you're saying, Pandy, hey, in HR, if it isn't written down, it didn't happen.
Right. Exactly. So that gives us a really nice segue into our next guest. Matt Strippelhoff and I have talked for a number of years, back and forth and back and forth. He has a wonderful IT organization down in Northern Kentucky, in my territory. And he sent me an email the other day and said, hey, look what I'm working on, and would you mind looking at it for me and giving me some ideas? And I tell you, I was just so impressed with just the presence and how user-friendly it was, and I could not get him on this show fast enough. So I have to tell you, viewers, you are hearing about this software for the first time of anybody in this area. Matt, welcome to COVID-19 HR and Business Updates. Tell us a little bit about who you are and what your company normally does.
Oh, sure. Yeah, absolutely. And by the way, I've got so much value from the first 30 minutes today. It's unbelievable. So thank you very much. I hope everybody got as much out of it as I did. So I founded Red Hawk Technologies 12 years ago with my business partner, and all we do is develop custom software. And just a little aside note, my wife had to apply for unemployment. She was let go because they had to shut the doors with the pandemic happening. And we learned a lot about applying for unemployment. And the one thing that I realized immediately is, as I looked at the state of Ohio's process and that workflow, and it is just garbage. And I shared that with my business partner, and we're like, oh my gosh, our clients would fire us if we wrote software that bad. I'm sorry to say, I just have to throw it out there and just throw them under the bus, because it was just so confusing and backwards. And they would say, you've got a message waiting that you have to respond to, and you have this period of time to respond to it. And then you get a separate email later saying, our system's all messed up. So that message isn't going to be there for a few days, which means it's not going to be there until after the period of time that you have to respond to it is expired. So it's just a train wreck. So I feel for everybody who's having to deal with that. I'm sorry. I wish we had wrote it. It would be better.
Still time. There's still time.
There's still time, right? So, so that's all we do is we work with primarily small businesses. So these are mid-market and smaller companies, and it's a real mix of clients that we have. But we develop web and mobile applications. That's all we do.
So, how in the world did you get into a wellness or a symptom screening application? Don't you have better things to be doing?
Yeah, because nobody's paying me to do it, right? So part of our culture is giving back and trying to make a difference. Anytime that something happens and we've got capacity, we look inward. We've got a great team. It's a great culture, and we're like, what can we do to make a difference? And so we were finding other ways to help. And one of the first things we did in the first week is we actually rolled out a text messaging solution that allows a nonprofit to be able to notify everybody updates via text, sends it out to the whole group all at once. We rolled that out within a week. So we have one nonprofit that's using that. And then by the relationships that I've had over the years. I have a wonderful client of mine. She owns and operates a manufacturing company down in Northern Kentucky. And she reached out to me and she said, "Man, if anybody's got something or is creating something or knows about something, it's you. Do you have any ideas for me?" And I said, "Well, what's the challenge? What are you faced with?" And she said, "Well, I need a way that I can really keep good documents and good tracking and make sure that my employees are self-screening. It's mandated by the state of Kentucky that they have to identify whether or not they're experiencing any of the multitude of symptoms that the CDC has listed on their website, and whether or not they have a fever of 100.4 or greater." I'm like, "Well, how are you doing it now?" She goes, "Kind of, take your temperature before you come to work. If you have a fever, don't come, right? Or if you're feeling bad, don't come." And I said, "Well, what are you doing from a record keeping perspective?" "Well, that's the problem, right? That's a big part of the problem." And while they can have somebody with a thermometer at the front desk, the early shift comes in before there's anybody at the front desk to operate the thermometer. So I'm like, "Well, that's really interesting." So I reached out to 19 other businesses that we work with. And I said, "Do you have the same problem?" And they all had the problem. Two of the companies I'll talk to are a little bit larger. They have 800 plus or minus employees. Two of those were looking at kiosks that would do all of this for them. They're $3,000 per location. Right? But the state of Ohio, Kentucky, Indiana, all require self-screening. It's mandated for reopening. Self-screening being key here, right? They're saying it's okay for your employees to tell you whether or not they have symptoms and tell you whether or not they have a fever. That's acceptable. So, we felt there needed to be a more affordable way to do this. So the next step was research. I spent the next 3 days digging through everything I could find out there to see if there were solutions that would work for the small business and the nonprofit. And I found a couple of web-based forms, but none of it was data-driven. It's not keeping any records. Kind of loosey-goosey stuff, not very good quality. And there just wasn't anything legitimate. So I went back to those 19 companies and I said, I asked them all, I said, "How many of you guys would participate in a planning session with me? Just one-on-one phone call. Let's just make sure that we're dotting the I's and crossing the T's and we create something that you can use." And 7 of those companies participated. So I spent the next couple of days just planning out what this thing needed to have in it, right? And then researching what the state of Ohio, Kentucky, and Indiana would require. And we have a 4-question survey that's part of this. The first question is, have you experienced any of the following symptoms? So there's some yes and no answers there. We also learned that all of our customers felt that they needed to have the ability to ask for temperature less than 100.4 because they feel more comfortable, and their HR policy states that if you have a fever of 100 degrees or greater, we want you to stay home. Okay? Yeah. So we're writing the software to their specifications. So any of the companies that choose to use it or take advantage of it, we'll have a default of 100.4 as the temperature, but you can set that to whatever you want it to be based on your policy. Now, we're not in the business of writing HR policies. We're not legal advisors or anything like that. We're a software company. So we're just writing this application to meet those companies that we've interviewed, meet their needs. And so we're pretty excited about it. And I'm hoping to learn a little bit more from talking with you guys today, because we're building a race car. It's about ready to hit the racetrack. But if we learn from our audience, anyone interested, you can reach out to me at redhawk-tech.com if you have some input or some additional suggestions. Just gathering tons of feedback right now, but our goal is to have the product done the week of the 15th. Our first customer will start using it on Friday the 19th of June. So we're very, very close to having this ready to go.
Well, and one of the things that you and I talked about in our second conversation, I guess, was the fact that there was a little confusion about HIPAA and HIPAA's involvement in this kind of information. And so I'm Scott, chime in. When you're collecting information like this, you're collecting it from the individuals. So individuals are communicating to their employer. That doesn't involve HIPAA.
Not HIPAA. Let's just make sure, because I get this all the time, and I get this from insurance companies all the time. Well, that's HIPAA. No, it's not. All right. So HIPAA is only information that comes from 3 sources. One is it comes from an insurance company. Mm-hmm. That's one. or it comes from a doctor, or it comes from a third-party administrator. If someone comes up to you and says, I got a temperature of 105, okay, that ain't HIPAA. That ain't HIPAA. Somebody comes up and says they're pregnant. That ain't HIPAA. So any other source, now it's still confidential, don't get me wrong, but it isn't HIPAA. And the difference between being confidential is, well, we're going to keep this secured, and HIPAA with 10 different rules of prison. So HIPAA is very involved, very, oh my gosh, it's a nightmare, but you can kind of understand why. But what Matt is collecting, I'm not hearing one single hint of anything even close to HIPAA.
Oh, that's good news, right? So and it's all going to be secure and encrypted. It's only the employer can access it. The results will be date and time stamped. So I won't call it contact tracing, but if you needed to run a report to see who was in at the same time, you'd certainly be able to get to that information as well.
Yeah. Is this all digital, or do you print it out, or does it just remain digital? How do you keep these records?
It's all digital. Now, if you, we're going to include the option to export the reports to a CSV file that you can open up in Excel. So if you wanted to do something like pivot tables and more sophisticated reporting, which I don't know how many of our customers will actually need, you can do that using other tools. We're going to give them an easy way to get the data out, but it's all going to be digital.
The reason I ask is this is going to be ADA. I mean, it is going to be medical, but you might have to print it, like we were talking just before we got started here. Can you show records that you are tracing this stuff and are just keeping records? And it sounds like this would do it for you. And there's really no reason to print it. And if you ever did print it for someone individual, that would go into their medical file, not their personnel file. So it sounds wonderful to me.
Excellent. That's good feedback. That's really good to know. And we do plan on making the survey itself and the experience itself ADA compliant. So if someone's using a reader browser, they can still complete the process.
And elaborate, Matt, too, on the triggers, because when you were talking to me, you know, if someone does answer a question, say, yeah, I'm carrying 100.4, that alert would then be sent to a designated individual. And what would that message say? Sure.
So right now, the way that it's planned to work is that if an individual, I'm kind of glancing over at my screen here again, right? So a no-go, the first thing I'll touch on is how we're going to determine if it's a no-go, right? So, and we're defaulting to the state of Kentucky. They provide a little bit more clarification around what they would suggest as a no-go versus others. Okay. Everybody's sort of rolling up to the CDC's guidelines, et cetera, but Kentucky's done a little bit more of a job kind of clarifying it. So if the employee answers yes to one or more of the screening questions, which are the symptoms, so if they're experiencing one or more of those symptoms and they have a temperature of 100.4 or higher, that would be an automatic no-go. And then it's really up to the employer beyond that if they want to have any additional policies or anything that they want to customize for them for their own purposes. But everybody that we've talked to so far, they're good with that guideline, with the one exception that they might modify the temperature to be less than 100.4. So in that event, to answer your question about alert, we're just going to send whoever the employer designates that should be notified that someone has failed a screening. We're just going to send them a text message that lets them know that they need to log into the dashboard. We're not actually going to include any of the personal identifiable information in the message itself. Just, hey, you need to log in and go look, somebody's failed the screening.
Will the employer then know who?
Once they log in, they will be able to see in the dashboard who. Absolutely. The details there. We're just securing it so that if you're not going to be walking around in a facility and all of a sudden you get this message or somebody's looking over your shoulder because you're having a conversation and then boom, hey, Bob failed the screening. You know, we don't know if that's good, bad, or indifferent, but it just felt like it's something we really needed to secure.
No, Scott, I'm going to speak for Scott. We both like that. Let it go to people who have a need to know, and then they will disseminate and pass the information on further than that. But that's a key point right there. You don't want the first line supervisors looking up and going, oh, someone just tested or someone just failed the COVID test. You know, you're going to have to work 2 jobs because then it'll be rampant. And we'll go back to our word hysteria.
That's right. So yeah, I like this because it's something's going on with the person, and we're also COVID, hypersensitive now. I mean, it could be something else. I mean, honestly, we still talk about the flu and colds. I can tell you, you can get a cold and you can lose that employee for 3 or 4 days. It's not going to kill you probably, but you know.
Yeah, that's a good point. We were talking about, you know, the longevity. So we're making a several, you know, pretty significant investment to create this product for our customers, right? So we have to make the business decision, you know, how long are people going to need it? So I asked that question, and the general consensus is 12 months, 18 months, when's there going to be a vaccine? And then after the vaccine's available, maybe the survey gets modified and the first question is, have you been vaccinated? And then that determines whether you continue or not. So we think it's going to have a shelf life as long as it needs to have, but ultimately the goal is to help these small businesses and nonprofits and really larger companies too, if they feel like if they don't already have a solution.
Yeah.
Well, we put a lot of emphasis over the last couple of shows on the importance of self-reporting and having the employees do self-reporting to begin with. And then we also have emphasized on a couple of shows the leniency or the expansion of guidelines with the EEOC and how we're permitted to ask certain questions related to COVID-19 symptoms, not any medical situation, but under COVID. And this just seems like a wonderful platform for an organization that has maybe even just a number of individuals that they wouldn't possibly be able to stand there and scan at a doorway, especially if they're at multiple locations. I've got an IT company that's got 89 employees and not even a third of them are within a 50-mile radius of the office. So, you know, wouldn't they want to know? Yeah, they would need to know. And if this kind of technology would certainly help them work through that and again, contain the information in a proper manner.
Yeah, I think so. Yeah, a lot of the customers that we were talking about, we were trying to understand some of the benefits to this, right? And some of them are cultural, you know, right? So you're demonstrating a good faith effort to make sure that you're providing a good, healthy work environment and keeping everybody safe. You're providing a way for people to do this in a very secure, private manner, so they're not standing in a line in front of the time clock 6 feet apart. You know, so you're creating a greater sense of normalcy. You're expediting the process of starting the workday. So there's all kinds of other benefits that people are identifying for us. We're thinking of it from a data perspective because we're a software company, right? But as we're asking those questions, these are the things that they're starting to identify. So
ask you on a daily basis, is this something me as an employee, I work at ABC company and I come in and I go through this little test every day. Is that how this works? Or why don't you give me the idea of because I'm like, is this weekly or do I feel like it? Or how do you envision this?
Well, based on Ohio, Kentucky, and Indiana, and what we're seeing is they all have their variations in language, right? But this is what you're required to do to start, you know, get back into the office and start work. All three of those states, and we'll be looking at others beyond the tri-state here soon. Georgia, by the way, I've looked at. I have a brother who's a CEO of a company down in Georgia, and he took a look at it as well and sent me some information. So it meets Georgia's requirements too. If there's
very good
on here. They're requiring every 24 hours that the employee self-screen. That's what we're seeing from the paperwork, right? So we're going to actually have a rule in the system that says you got to do it every 24 hours.
Just like clocking in or logging into your computer.
Absolutely. Preferably just before you start your shift. That's when they want you to do it.
And this software, well, I'm in HR, so I don't necessarily like paperwork. So this will slice and dice the reports however I want them. And you're going to take care of this software is going to keep all the records for me. And if I need them, I can get to them.
That's right. And there's nothing to download, install, It's not, as cool as mobile apps are, we love them, we create them. There's no need for this to be something that people have to download on their phones. And oh, by the way, we have the number of manufacturing clients that we talk to where some of the folks in the shop are using burner phones or their phone number changes frequently. We have a plan to handle that workflow as well. So it's really seamless. So we're actually, every employee is going to have a PIN. They don't have to remember a username and password. And so they just need to know the link. They bring it up on their phone. They can use their desktop. You can have somebody at the front desk. If you still want to have somebody at your front desk, a thermometer, you can just have a computer there or a tablet or something for people to use. And you take their temperature and tell them what to answer for that question. And the whole system still works. So there's a number of different ways to deploy it.
Well, let me ask you, how do you take your temperature? If I'm sitting there, do I have something handy to take my temperature with, or how does that work? The employer takes care of that.
The employer has to, if you're going to require people so there's different options here. So most of the customers that we're talking with are going to allow their employees to self-screen before they arrive. So they'll use their own thermometer.
Sure. Yeah.
Now, for those who want to validate or have an additional step involved, they can have somebody checking their temperature when they arrive at the door.
Okay. Okay.
You know, that's totally up to them. Yeah.
Yeah. Yeah. Try to buy our thermometer these days.
Right. Well, I'll tell you what, I was talking to a good friend of mine about this platform, and I won't name the company that his wife works for. It's a pretty big technology company in terms of hardware and services, right? They're not a software company, but they're one of the companies you would call to try and buy some of these kiosks that are available with thermal scanners.
Yes, I've seen.
Okay, right. Now, so one of the challenges that we found out doing our research is a lot of those thermal scanners do not measure temperature within the proper threshold. So when the CDC is saying 100.4 and you got a variance of 2 to 3 degrees, it doesn't do you any good.
2 or 3 degrees on some of these things?
Some of them. Some of the ones that had really widely ranging that I saw was 1 to 2 degrees. So 3 might be a stretch, but 1 to 2 degrees.
1 degree makes a big difference. It's whether I'm at home or, crashed on the couch, or that's interesting. We just bought a new thermometer and I got shell shocked because it was $100+. I'm used to the little mercury things.
Yeah.
And you just make sure it doesn't say rectal, that's what I'm used to, but oh no, you can't buy those $100 thermometers now. They're all over. So I don't know if anybody else is doing what you're doing.
Yeah, we found a few similar solutions, but most companies are focused. These are big security card providers. These are the companies that have they're already providing your employees with security cards and barcode scanners, and they're scanning at the door, right? Those companies are rolling out kiosks with all kinds of, but those are the $3,000 a pop deployments. And guess what? You still have to stand 6 feet apart, use this piece of equipment that you have to clean between everybody using it.
Yeah.
Yeah. Because you have to answer the questions. It's not just a thermometer.
Yeah.
And you got to integrate it with your HR stuff. And then you've got hardware and software costs to keep track of. So it's just
the data from the employee themselves. Does it have aspects to be able to keep track of this? What Pandy and I were talking about for, okay, these are the people that have been trained. These are the measures we've taken. But is there a way to add that in there? Or is that going to be a separate program? You're just focusing on the employee health monitoring right now.
The first release that's coming out June 15th is just focused on the health screening and getting back into the office. But we are going to be including professional services to customize it for employers based on what they think they want to have in there. So a checkbox for training is certainly not a big deal to have in there.
See, my clients right now, it's easy to train them, really. It's easy to follow the OSHA guidelines. The self-monitoring they're doing, but right now is exactly what Pandy said. We're taking their word for it. Honestly, I think this would be a godsend to most of my clients because they don't really have to, they install the software and then they don't have to do anything.
Yeah, right. We set it up for the employer and they just disseminate a link, right? So they can send out an email to everybody in their organization. Here it is. Now, here's the link to the policy, which we won't manage that part, right? But here's the policy, and the employee handbook now says you got to do this every day. And here's the link.
No, everything I've heard, this is completely ADA compliant.
Completely. That's awesome.
I just see one hesitation here, and I want employers and the businesses that are watching to really think about this, because it's so easy for Scott and I to stand here and say, oh yeah, just we get a policy together and start implementing this great process. But please understand that what if one of your employees decide they're not going to do it? What if they decide I'm not going to take my temperature every day, or I don't have to go through that process. You as an employer have to decide, is this a condition of employment for you? This is a big, big decision. And it's gonna come up somewhere with someone. You're gonna have that one employee, and maybe you've already had it. Maybe it's the one employee who doesn't want to wear a mask, and it's the one employee who doesn't really believe that the virus exists and they're conspiracists. I don't know.
I'm getting that now. I'm getting that now.
It's the one who shows up with a pandemic shirt on.
Well,
Yeah.
I'm not saying right or wrong. I've seen Soylent Green. I mean, I get this whole thing. But as employers, you need to really be thinking about this. And if you're an HR person and you're watching today and you're thinking, oh, that's what we want to do, that, hey guys, there's some back work you need to get done before you start implementing this kind of stuff. And yes, the state guidelines are what they are. We can't change them, but you need to be prepared to face those conversations with your employees and understand where's the line in the sand. You're the employer, you own the business, it's your decision. You're ultimately where the buck stops. And it's a tough conversation, isn't it, Scott?
It is, but I will tell you right now, I tell my client, I mean, it's my client's decision, but I will tell you right now, if you're going to do it right.
Yes.
It's just it. If you're not going to do it right, it's like substance abuse testing. If the worst thing you can do is put substance abuse testing in place and then go, oh yeah, but it's Bill and it's just pot. Okay. I mean, Bill's a good guy. Okay. When he's not high, Bill's a good guy. No, if you're going to do it, do it. And if not, throw it in the garbage. Yeah. And now you do have to worry about all those other things that you were afraid of. But honestly, I can tell you, as my company right now, it's like, this isn't optional. It's like safety glasses. It's like steel-toed shoes. Is it? Well, I don't want to wear them. Then you don't want to work here? Because you're not going to make me sick, and you're not going to have me take something home to my children or grandchildren or something like this. There is nobody that good.
Well, if you're going to make an investment to protect your employees, and remember, this is a part of your culture, it's a part of your mission. If you truly take that seriously,
right?
Say, I'm going to put everything in place possible to take care of my family,
right?
As you say, then you make sure that everybody's on the same page. You make sure your entire management team is speaking the same language, and that everybody understands why that line is in the sand. Matt, I can't thank you enough. I just again feel so privileged that we got to introduce this whole idea and your concept to the viewers. Again, you're willing to share some of your prototyping or talk to potential employers?
Absolutely. Yeah, shoot me a link. Shoot me a link at my website. Shoot me an email. I got clients that are just going to love you.
Absolutely. Yeah. Thank you, Scott. I will do that for sure.
Oh, yes. God send to them.
Good. Well, I can't tell you how much I've enjoyed this show today. And again, Matt, you gave me another opportunity to do what Scott and all the other presenters have tried very, very hard to do over the last few weeks, and that's to provide relevant, pertinent, factual information and options for our viewers. This is not over. We all know that. We've all agreed that change is the only constant in the universe. So things are going to continue to change and modify. Oh, I forgot one more update. The EEO1 report has been extended through March of 2021. So if that's kind of left your mind, which for most of us it has,
yeah, really,
let it stay away, because 2019, 2020 will not be expected till 2021. You can find that online if you need to double check those dates. But again, it's so much fun bringing this information to you. And I, again, want all the feedback that you can give us. Keep your questions coming. Reach out to any of our presenters at any time. And again, thank you to ICRC-TV for giving us this platform and this time and their equipment to provide this information to all of you. Please take care. And again, my name is Pandy Pridemore, founder and principal consultant for the Human Resource USA. Scott, Matt.
Thank you.
Take care.
Thank you, guys. Thank you.
Thank you.